Good afternoon, Board of Health members. We are live and ready to record when you are.
Thank you. Please rise for the Pledge of Allegiance.
I pledge allegiance to the flag of the United States of America and to the republic for which it stands, one nation under God, indivisible, with liberty and justice for all.
Thank you. I would like to, Mr. Pratt, Attorney Certification of Agenda.
Thank you, President Benevito. All items on the agenda today have been reviewed by the County Attorney's Office and meet legal approval.
Okay, thank you very much. Are there any member disclosures for any items on this agenda? I have none.
I have none.
I have none.
No, sir.
Thank you very much. So I'm going to move on to the consent agenda. Has everybody reviewed the the minutes from the last meeting? And if there are no changes to that, I would like to move approval of them.
Mr. Chair, I'll make a motion to approve the minutes from the last Douglas County Board of Health meeting being January 13th, 2022.
Second.
All right. All in favor, say aye.
Aye.
Aye. Opposed? Thank you. Thanks. We'll move into the regular to the regular agenda. I just want to make a few comments beforehand. First, I want to note that last session, the state legislature passed a requirement that Board of Health members need to do an online training annually. There is no deadline for doing this. But the sooner we do it, the better. Certainly there's, I think going to be some expectation that get done. I think one of our members already has done it. I won't mention a name, Commissioner Thomas. But if we all could take the time to do it, I think it shouldn't take more than an hour and a half, 2 hours.
No.
Yeah. Okay. And so if everybody would do, I have not done it yet, so I'm certainly not chastising anybody. I just want to bring it to everyone's attention. Second, the county commissioners put out a press release calling for alternates for the Board of Health members. There may be times when Board of Health members can't make it, and we should have established alternates. If you know of people, or if anybody's listening that would like to put an application in, we will be reviewing those. And I think the commissioners actually will be reviewing those and making a choice. So if you would like to be considered, please go to the county's website. You can look for the press release, or you can just go to the Board of Health website, and you can put in an application to be an alternate. I want to note on one of the agenda items that we have today, which is we are going to, I believe, approve the Public Health Director contract. That's the first item, item A on the agenda. I'm really excited about this, and I'm excited about this for a whole lot of reasons. One, we got a great candidate. He really stood out, and we had a great pool of candidates generally, but among a great pool of candidates, we had one that particularly stood out, Michael Hill. And I'm excited that we're going to have a new leader coming in as quickly as we are. These processes I've done this before, these processes can take a long, long time. And one of the things I want to compliment the board on, and the county commissioners, is that we moved through this expeditiously. People were available, people reviewed what they needed to review. We did the interviews, people were decisive in in their opinions on candidates. They were decisive and unanimous on the final choice. And we moved quickly. We moved quickly on a contract. Thank you very much, Laura Leary, because we moved quickly in large part because of your prodding and also your organizational skills. So thank you very much. And so I'm excited for that reason. I'm also excited because, quite frankly, I think we're at the end of the pandemic. I think it's over. I think the pandemic is done, and we are bringing somebody in now who can focus on public health issues that, because of the pandemic, may not have received the focus that they needed to receive over the past 2 years. You know, we're blessed to live in this county. We have, it's just beautiful. We have, the geographic area is beautiful. The people are great. We have excellent leadership in the county. But that doesn't mean that we are absent any issues that need to be worked on from a public health perspective. I think the county commissioners have recognized this, and they've dove into issues like behavioral health, which is, I think, a model not just for Colorado, but also for the nation about how it could be dealt. And I look forward to having a public health director come in that can help, can assist in that. Can be value added to the ongoing activities that are occurring, and I think a public health department can be value added to that. We have other issues that we discovered when we did our survey. Among them were, one of the issues in this county is, frankly, injuries from slip and fall. You know, why that occurs and why that's happening, we need to dive into and we need to figure out, but it is an issue. And then there are just the basic blocking and tackling issues of running a public health department, you know, restaurant inspections, septic. What people don't know is, because we're a growing county, that's a bigger issue here than it is in any other county that was of the former Tri-County Health Department. That's important certainly from a public health perspective. As a former head of CDPHE, as a former deputy EPA, water quality is a big issue. But it's also important from an economic issue. And we need to be able to work these issues and these permits so that we can have reasonable, appropriate growth in the county as planning committees and as the commissioners deem appropriate. And those are the things that we're going to, I think, be working on as we move forward. And I look forward to having the new public health director start, so we can sit down and have a discussion on sort of a strategic view on all of these things, and we can talk to him about how we want to move forward, how he's going to move forward in implementing these and many other things to ensure that we have a public health department that serves the needs of the citizens and improves quality of life in Douglas County. So I'm really excited about that. So I will ask any of my colleagues if they have any comments before we start, and if you do, great. If you do not, we will start moving to the first agenda item, which in fact is the approval of the Public Health Director contract. And Ms. Leary's already at the podium, so fire when ready.
All right, so good afternoon to the Board of Health. President Benevento, you did a great job taking a lot of the words that I was going to use and talk about a little bit with respect to the process. It was a nationwide search that we conducted beginning in Q4 of last year, and that we concluded in January of this year. And hopefully today will be the last piece of it, which would be the ratification and signing of Michael Hill's employment contract. He and I have been in close contact over the last several weeks, and he's a great guy to talk to, and very calm and organized in his own way, so it's been a very easy opportunity to get somebody to this place, and so that's been really super helpful. We have it today. All the legal signatures and financial signatures have been completed, so it is really at this point just handed back over to the Board of Health for you to evaluate, and then if we receive a move forward, what we would do is within the next 30 days, as our County Attorney Chris Pratt has mentioned, within the next 30 days we have to provide information to CDPHE. We're all ready for that information. The application is ready to go. What that is simply the ability for CDPHE to be able to evaluate and review Mr. Hill's experience and credentials, of which he has close to 30 years in public health. So he certainly meets the minimum qualifications for the position. And then they are able to get back and certify that for us as well. So that will be the final step in terms of onboarding Mr. Hill.
Thank you.
Welcome.
Are there any questions for Ms. Leary?
Actually, if I may.
Commissioner Teal and Commissioner Thomas.
Oh, thank you so much. Thank you, Laura, for bringing this to us today. But just to make sure I understand the role of the board today, our role will be to ratify and accept the contract that was concluded with Michael Hill for the position of Public Health Director, Douglas County, Colorado.
That is correct.
Okay, thank you, ma'am.
I would just like to thank you, Laura, for your leadership in finding the headhunter, whatever that correct word is for that, the recruiter, because we really did have some interesting resumes. I read through all of them, and there were some very interesting ones. There was a lot of passion for public health there. And I was pleased with the candidates that we did interview. And I really liked Mr. Hill's demeanor, like when you said he's easy to speak with. When I met with him with a group of citizens, there were some who asked him some really tough questions, and his demeanor never changed. He was very even and answered their questions. I was really proud to have been with him that night, and I thought, this is exactly who we need in Douglas County to help us tailor-make our public health department to meet the needs of our really unique citizens here. So thank you for the role you played and everything you've done to negotiate the contract to get it to the point it is today. Thank you.
Any other questions or comments from board members? Well then, are there any public comment in the room that anybody would like to make? Is there, Ms. Dunning, are there any comments online?
Thank you, Mr. President. I do not have any hands raised. I do not believe we have any comments.
Okay. Well, then I would seek a motion to approve the Public Health Director contract.
Mr. President, if it pleases the board, I'd like to make a motion to ratify and accept the contract that was agreed to with Michael Hill as Public Health Director, Douglas County, Colorado.
Thank you. Do we have a second?
I will second that, Mr. Chair.
Thank you very much. All in favor, say aye.
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 Aye. Opposed? Thank you. We now have a Public Health Director. Thank you, Ms. Leary. I've asked Ms. Drake to provide an overview of the medical officer hiring medical officer hiring. I keep wanting to say chief medical officer, but that's not great. The medical officer hiring requirements. As I think as the board member knows, but in the event that there are members of the public that are listening, if you hire somebody as the public health director who is not a doctor, you're required to have a doctor, a medical officer that is on call, that can provide medical advice as necessary, both to the public health director and the board, and certainly the county commissioners. There's multiple ways this could be done that I fear I'm about to start stealing your thunder, so I'm going to stop right there and say, Ms. Drake, why don't you go through this?
Thank you. Good afternoon, President Benevento and members of the Board of Health. So you have, I think you all received this electronically earlier today, but you have a hard copy in front of you as well. So the first section of this talks about what's contained in the Colorado statute and Colorado Code of Regulations with regard to a public health medical officer. So I will read it for the benefit of the public, but the statute states that if the public health director is not a physician, the Board of Health shall employ or contract with at least one medical officer to advise the public health director on medical decisions. And then it's kind of a drop down to that in the Colorado Code of Regulations 1014-6. It further states, if the public health director is not a licensed physician, a designated medical officer or advisor shall be employed or contracted, paid or volunteer by the County Board of Health to advise the public health director on medical decisions and be available at all times to the public health director. The medical officer must be a graduate from an approved medical school, an MD or a DO, and licensed to practice medicine in the state of Colorado. And that's the exact wording that comes from the Code of Regulations as approved by the State Board of Health. And then the third paragraph talks about what are the requirements in the event there's a vacancy in actually either in the public health or public health director or medical director, and some options for that, including getting the services from another county and or actually from the State Department on a short-term basis while those vacancies are filled. And then, excuse me, following that are some examples of how the medical officer requirements are filled in a lot of our counties in the state, in particular a lot of either large counties or kind of medium population size counties similar to Douglas County. So you see Jefferson County has a contract with Denver Health and Hospitals. Weld has 2 primary care physicians that are actually temporary part-time. El Paso is currently recruiting for a medical officer, but has Dr. Chris Urbina is currently serving as their interim. Larimer County has a medical officer. You can see that they are also a temporary non-benefited employee. Mesa County, same thing. Their medical director is an employee of public health, but works 0.5 FTE. I included Northeast Colorado Department of Health, which is a district health department, because I thought it was interesting that their medical officer actually works under the Director of Client Services, not directly under the Public Health Director. And then Dr. Chris Urbina, who is also the medical director for Pueblo County and the interim director for El Paso, has served as a medical director for Larimer, Boulder, and Broomfield counties, been the Denver Department of Health director, and also, along with President Benevento, was the executive director of CDPHE at different times, obviously. But I found it interesting that he is working with medical schools in the state to try to work to find physicians that are interested in serving in the public health realm. And so, and the other thing, he was recommended to me by CDPHE, because he's been a medical director in many different counties. They thought it would be helpful to understand what is the typical scope of work that a medical director sort of winds up having to do in a county our size, or even some of these other counties that are larger. And you see throughout this that many counties really say they only use this person, for specific consulting needs. In other words, it's not, you don't get the impression that it's like a daily occurrence that they're utilizing the services of their medical officer. So I've reached out to Dr. Urbina to talk with him early next week, just to get a better sense of, what the scope of this kind of work is based on his experience, and also understand a little bit more about what he's doing with the medical schools. Is there an option there for us, someone up and coming that might be interested in working with Douglas County? And then lastly, I included some information from Tom Butts with Colorado Environmental Public Health Services. He's worked with multiple public health departments around the state, and he is currently consulting with Douglas County. And the trend is clearly moving away from hiring physicians as public health directors, which necessitates us hiring a medical officer in order to comply with the statute. And the trend also seems to be to contract more often than bring people on as an employee, although there are some examples of that. But contract with an individual physician, hospital, or physician group, or hire the medical officer, but in a kind of part-time temporary position. And then lastly, particularly in larger populations, there does seem to be an effort to contract with or hire a medical officer, physicians that also have either a master's in public health or some public health experience. And I would just conclude with county staff is happy to take direction from the Board of Health and the public health director when he arrives to develop options for securing a medical officer for our Douglas County Health Department.
Thank you. Are there questions? This is really interesting because you've done a really nice job, I think, of laying out sort of a pattern of how public medical officers are working, and what the available options are in terms of we can contract out, you could hire somebody full-time, though that may be a little bit much. And I do agree. I think this is something that Mr. Hill needs to have a lot of have input into. certainly the medical officer and he would be working, particularly when it most counts, would be working very closely together on issues. So I really do appreciate that. I think we have some, great resources here in Douglas County. I think we've done a good job over time of using our Douglas County resources. So I would just encourage us to, whether it's, we have Skyridge down the road, we have a lot of medical resources here in the county. So I think to the extent that we can do that, we did a great job, I think, with Jogan and actually going in-house. But thank you, Ms. Drake. This is really helpful. Any other comments or questions? Oh, yes, Commissioner Thomas.
I did think of something else. When I became the coroner in 2011 and I got into that office, there was a full-time forensic pathologist in the office. And Douglas County didn't need to have a full-time doctor on staff, so I let that person go. And I was able to contract with 4 different forensic pathologists who only came and worked for us when we needed an autopsy done. And I think the first year we did 103 autopsies, so I paid about $100,000, a little over $100,000 for autopsies. The contract for this individual was $217,000. So I think we need to really understand that this is not a position for a full-time doctor, and you really have laid out a lot of different options here that are used in other public health departments. And I think once Mr. Hill is here, I think he needs to have a significant role in deciding how we do this. And your excellent research is going to be a good foundation for those conversations. So thank you, Ms. Drake.
Commissioner Teal.
Yeah, I guess the thing that strikes me, the only thing that gives me pause, and Barbara, I apologize, but I want to focus on something you talked about with maybe trying to get a doctor that's up and coming, and in working with Dr. Urbina in order to identify somebody perhaps of no small accomplishment, fresh from school or coming out of initial training and everything. Here's my concern, and this kind of goes also to the concern I have about full-time, part-time, is I look at these other departments, perhaps the only exception being Jefferson County, and these aren't public health departments that have been in the news this week. These aren't public health departments that have been under the level of scrutiny we have been under. And so, yeah, I'm more inclined to, well, I mean, we're just spitballing here. We're just kind of shaping a conversation. But I'm more inclined to go with an experienced physician, a physician that does have public health experience, as is actually not, I noted, not called out in this quite the same way that a public health director was called out in statute. But we probably do want just that. And I don't know, Commissioner Thomas, you made a really good point about your experience in the coroner's office and having the medical officer there of, did that salary really justify $200,000 a year? I think you are spot on in your analysis as serving the people of Douglas County as the coroner. I guess I want us to have maybe a little more latitude, and only because we're in a startup situation. And I think about my time in business, being in startup companies, where the salaries were a little on the crazy side, or if not the salaries, the bonus and the vesting, the ownership vesting for the startup team was just crazy, outrageous. Janitors becoming millionaires, kind of stuff. But that was a startup. And, we look at something like Google, Facebook, they're not startups anymore. There are not outlandish salaries being paid. There's not outlandish compensation plans like they are when they are a startup. So actually, I don't know. I'd actually kind of like to see us on a path where maybe we are generous with what we pay that medical officer as a startup, to get us out the door, to get us up and running, knowing that whoever the medical officer is, just like Mr. Hill and the compensation plan that we just ratified, the reality is, he's going to be getting his hands a whole lot dirtier now than he will as the system is built out, the department is built out. So, I don't know. Obviously, Mr. President, you need to decide what level, and guide the board on what level of direction we want to give staff concluding this information briefing. But yeah, I'm kind of, I look at some of these and boy, yes, I realize that some of these counties, and thanks Barbara for putting this together, they look like us, they're a little bigger than us, maybe they're a little smaller than us, but they're not startups like we are. So I think that's how I'd like to shape the conversation.
Director Marmaro.
I'd just like to add, I really appreciated that Michael Hill has a lot of experience. He has a depth and breadth of experience. He's done startups before, so he has a ton of experience to bring to the table in making this decision. I also agree that we should wait until he arrives to help us to inform that particular decision, because he does have so much experience. I think that'd be valuable.
Commissioner, or Dr. Fielding.
Thank you, Mr. Chair.
I almost demoted you.
That's okay. Oh, yes, but I agree with Commissioner Teal. I'm a bit concerned that this is a startup, and we've been under a lot of public scrutiny. And so I think we need to probably pay for the experience of somebody that gives us as instant credibility as we possibly can. If we make changes later as the situation matures, that's one thing. But we're under a lot of scrutiny to get this public health department up and running, and everyone here has done an excellent job on that. And I think we should continue to do that.
So, I'm hearing agreement. I'm hearing agreement, I think, on, and thank you all, because the input's really valuable. I'm hearing agreement that Commissioner Teal, I think you make a great point. We want experience, and I think that we should be placing a premium on experience. I know Dr. Urbina, and he's certainly doing good work for, I think the public health community and the work he's doing with medical schools. But I think that what we're looking for, because in the event that something does happen, in the event that we do have some kind of need for a medical officer, we're going to want a steady hand, particularly as we're starting to ramp up as you said, as we're in the startup phase and we're starting to ramp up. And I think we want to make sure that we have the experience that we need. So I think as you're moving forward, and we'll talk to Mr. Hill about it when he gets here, but as we're moving forward, I think the direction that I'm hearing from the board is that we want somebody with experience. And then with that experience, I think is going to come, the necessity to perhaps pay some kind of premium for that person. And we can figure that out. We don't have to make that decision now, but, I think that we can figure that out as we go along. And I think ultimately that's a Board of County Commissioners decision. So I don't want to step too far. I don't want to step out at all outside of my lane in that. But I think that's kind of the direction we want to go. I think we certainly, I keep an open mind, but I think that we're looking also at contracting with somebody. I think that cuts down, I think that will allow us to attract somebody who has more experience. And it will also make the ultimate cost, I think, for the commissioners more palatable, as we're not having to deal with benefits or other aspects of full-time employment. So if I picked up the signals from my colleagues correctly, I think broadly that's the direction we're going. I think you should work towards, perhaps having something for us to discuss with Mr. Hill when he arrives. I think that's an early decision and part of the overall, I think, strategy we want to set as we move forward. And so if you would continue to move forward and collect information and get us organized so that we can have that discussion when he shows up, we would appreciate it. And
Just to clarify, are you comfortable with us pursuing options that we can present to Mr. Hill for an individual physician, a physician group, perhaps a hospital, like you see in some of the examples here, developing options in all those areas?
Yeah, I think and Mr. Pratt, who's the hiring authority?
statute puts this authority in the board's hands.
Okay, so, I mean, obviously, Mr. Hill will be an important factor in that, but yes, I think we're comfortable with you moving forward, examining options, outlining options, and then talking with us and Mr. Hill about it. And Mr. Teal, did you have or Commissioner Teal? Sorry.
Thank you, Mr. President. Yeah, I mean, and actually, Barbara, my question to put to you is, do you feel the need for a motion, or do you feel like you're getting enough guidance after I add my own 2 cents, of course? And I see you're shaking your head in the affirmative. I would like to be able to have a staff product that can be presented to Mr. Hill to work with the Board of Health in terms of, an individual. And actually, Mr. President, I'd like to kind of see what, full-time. I think we saw I think it was Mesa County, who is like a half-time FTE, as a 0.5 FTE, full-time equivalent. See those. I couldn't help but notice when we did the deal for Jogan Health Services as to take the place of Tri-County for COVID disease control here in the county, that medical officer services are also a service that they offer. And so really, I kind of have a potpourri. I mean, I asked Dr. Greg Smith, who knows a little bit about public health, to attend today. I'm probably going to have some questions for him. But yeah, even in, I don't know, he keeps saying no, but if he changes his mind, could Dr. Greg Smith be an option, meeting the qualifications? And then I'm sure that we have other physicians that probably could be found in our hospitals, like the president said. So I'd really like that. I'd like a real game plan for when we know, per the contract, when he's starting, that he's got a staff brief to basically start working on, and actually then start advising immediately the Board of Health to go to a hiring decision. Because again, I go back to the public scrutiny that we've been under. I think this is something, obviously we don't want to rush this decision. We want the right person for our department. But at the same token, we should act with purpose, and with as if we're on a mission. Barbara, did that at all provide any clarity?
I think that's plenty of guidance for us to proceed without a motion.
Okay.
Thank you.
No other questions? Okay. Everybody's good? Okay, thank you.
It looks like, do we want to take public?
If I could, Mr. President, I think this is on. Just a point of clarification. There was an item handed out to you, a 2-page document that was partially read into the record. This will be marked as exhibit number 1 for the record. And as a point of order, I think you wanted to do public comment on items?
Yeah, we're just about to move to that. I wanted to. So with that, is there any public comment in the room? Oh, yes, ma'am. Oh, if you could come up to the microphone so everybody can hear you, and just provide your name and the town that you live in, we would appreciate it. Thank you.
Thank you. My name's Elizabeth Emerson. I live in Highlands Ranch. I lived in Castle Rock for about 10 years, recently moved to Highlands Ranch. Pretty dedicated Douglas County person. I work in mental health, and my question for looking for the new medical officer to come alongside Michael Hill is, have you considered a mental health person as well? I'm a very strong advocate. I lobbied and advocated on the Parity Act. The Parity Act basically says that anytime there's any kind of medical, you guys are familiar with this, mental health needs to come alongside that. I think that needs to also be considered with our medical officers as well. So my question for you guys is that, have you considered looking for a person specifically for mental health to come alongside the new medical officer and to be advising now our new public health director?
Thank you. So, and the way we typically handle questions, we go through all public comment, then we'll wrap around to it on the
Okay.
back end. So I just don't want you to think we're ignoring you. We're not. We have a
This is
process.
new for me, so I'll figure it out.
Yeah, well, and we'll, and let's go through the comment, whatever other comments there are, and then I think we may have some thoughts on that.
Okay, so maybe that's a comment then.
Thank you. Thank you very much.
Thank you.
Is there any other public comment in the room? Ms. Dunning, are there any comments online?
Thank you, Mr. President. I do have one hand raised. This will be Mr. Robert Marshall.
Thank you.
And you are unmuted, sir. Go ahead.
If you just give your name and the town that you live in, please.
Yeah, did you hear that? I'm Robert Marshall from Highlands Ranch.
Thank you.
Okay. Yeah, I had just 3 items I wanted to bring up of concern. One is that lawsuit, which I haven't been able to get a hold of and look at just yet, but PIRA suing all 3 counties for $50 million in immediate payments as part of the dissolution of Tri-County Health Department. And I'm wondering if the Board of Health or the Board of County Commissioners has put a reserve in place or even discussed or considered their share of this requirement when they dissolve Tri-County Health Department. And secondly, on Director, again, you're all talking about hiring another medical director, which you have to because you didn't hire an MD. And I just want to point out that Dr. Douglas, which you all seem to have despised, was a Harvard-trained doctor with an infectious disease specialist. And the #1 purpose of every public health department in Colorado is infectious diseases. And yet we're here talking about slip and fall cases. I find that very disturbing. And then the third point is, I don't know if you all have made any effort to go back to Fusion Cell and ask WTH, what the heck with regards to their plagiarized report that they all sent you without giving any kind of reference to the HVAC Association, which they cut and pasted everything and gave no reference to it anywhere in the bibliography or as a footnote. And it's particularly disturbing since they left out the main conclusion of that HVAC for how effective HVAC was over masking and the like. It seemed pretty obvious it was put together to get to a conclusion. So somebody selling you a bill of goods like that, I would hope you try to make some effort to recoup that money. But thank you, that's all I have.
Thank you. I do want to circle back around to the question on, mental health, and I think you make a good point. And what I would propose is that this is something we talk to Mr. Hill when he starts, and certainly if you were interested in talking to him, he's a very accessible person. I'm sure he would spend the time to listen to, and he has a lot of background in this area as well. So I think you may find it an interesting conversation. But what I'll commit to you is that we will talk to Mr. Hill about it. And what I think when we're looking at behavioral health, I want to go back to the point I made earlier in my opening, which is that the county has done a really good job on this so far. And what we're trying to do is make sure that the public health, the new public health department is additive and assists in what the great work that's already being done. And what I would do is I would invite comment, from Commissioner Thomas or Commissioner Teal on the work that's being done and their thoughts on this. Commissioner Thomas.
Thank you, Elizabeth. Thank you for being here. In Douglas County, we certainly recognize the need for a better mental health system in our county. In 2014, while I happened to be the county coroner, we had a really unfortunate situation with a young man whose mother was working with the county, and we made a referral, and that agency dropped the ball. And he ended up getting a hold of his mother's firearm. He took his mother's life and then his own. His sister is now paralyzed because of all of that. After that happened, Douglas County made a commitment to our citizens. We were going to fix this. So Barbara Drake, sitting here, has worked really hard. And in May of 2017, we launched the first community response team. That's a police officer with a clinician. We now have 3 of those teams in the county. We also have another team dedicated directly to kids in schools, because 40% of the calls that the community response teams were going to were for kids. We now have $68 million in ARPA dollars, American Rescue Plan Act, My first priority, in fact, we just released a video last week I did. My first priority for that money is mental health funding because it's low-hanging fruit. We have worked in this county now for 5 years, and we have seen results. Our suicide numbers are down in 2019, 2020. I don't know that we've gotten 2021 numbers yet from the coroner's office, but last fall she did tell us that the trend was dropping for suicide numbers again. We've got a lot of great plans. Barbara Drake, the woman who made the presentation about the medical officer, is really the brains behind everything we have done in mental health in this county. So I would suggest you get with Barbara. I'd be happy to speak with you because we are going to continue doing all that we are and more in the realm of mental health. And we have discussed having a conversation if we're going to continue with our mental health program where it is, or if we're going to migrate it under the Board of Health. So that's a conversation we have noticed we need to decide, and we're waiting for Mr. Hill to get here to do that. So thank you for being here and letting us know that mental health is important to our citizens, and we are going to continue working on that. So thank you so much for being here. Thank you.
Commissioner Teal.
Thank you, Mr. President. Ma'am, one of the reasons why we thought Mike Hill was a really great candidate is he managed mental health operations for a county up in Illinois, but also he is actually he holds a pretty significant position now in California in his current job as really, I think the phrase is the steward. He is the public steward for mental health, and he's managed facilities. He has managed personnel in the mental health arena. And I think, actually, I want to give a lot of credit to Commissioner Thomas for kind of fleshing that out a little bit during that interview process. So, yeah, it is a reason why we brought him on, is that he will be bringing on that mental health management component that well, quite frankly, we don't see in other county public health departments. I mean, with all respect to Mr. Marshall, Dr. Douglas started doing a mental health program with Tri-County after Douglas County did, and I clearly remember a conversation with him last February where he talked about that being something new for him at the time. That's the neat part about Mike Hill. He's going to come on board with, I think, if I counted right, 8 to 10 years of cumulative experience in the mental health as well as public health arena. So, I think that really addresses your question right on the head, because we're going to trust him to do that right. And of course, please come back and tell us if he and us did it right.
Mr. President.
Yes, Director Merlo.
Thank you, Mr. President. I just wanted to add to that conversation. One of the things that we know about infectious disease is it's not just the biomedical aspect of it. It really is biomedical, it's psycho and social. We realize that those are all key components. So this will not be something that's forgotten or just left aside. It's a key component of what you look for with the Board of Health in infectious disease.
Thank you. Any other comments? Well, thank you. Thank you, by the way, for raising this important issue. We do appreciate it. And as you can see, it's an issue that our elected leadership is deeply engaged in. So please do come back and talk to us about how things are going. Ms. Dunning, are there any other comments online?
Thank you, Mr. President. I have no other comments.
Thank you. With that, then, we will move on to the next agenda item, which is an overview of Department of Health ARPA local support funding. Mr. Avery is going to provide that briefing to us.
Good afternoon, Board of Health members. Dan Avery for County Administration. I'd like to preface my remarks by saying that the Colorado Department of Public Health and Environment operates its Office of Public Health Practice, Planning, and Local Partnerships. This office acts as a liaison between local public health agencies and state and federal resources. They provide consultation, technical assistance, and financial resources to local public health agencies, and they've been a valuable resource to county staff during this transition process. Over the next 3 fiscal years, the state is devoting an additional $30 million in funding to local public health agencies as approved under Senate Bill 21-243. As you can see on this slide from the state, funding provided in fiscal year 22 comes from the state's allocation of the American Rescue Plan Act funds. In future years, the funds will come from the state general fund. In fiscal year 22, which covers the period from July 1 of 2021 to June 30th of 2022, Douglas County is eligible for $519,000 in reimbursement for eligible expenses from this source of funding. For fiscal year 22, eligible expenditures are those allowed under the American Rescue Plan Act and identified on the state's list of focused expenditure categories listed here. As you can see, most of these categories are responsive to COVID-19 and its impacts. The final rule does provide some additional expenditure opportunities, including expenditures focused on process improvement in public health and technological investments that facilitate public health responsiveness and efficiency. You can also see on this list that mental health services and substance use services may be reimbursed, as well as services that provide housing support for persons impacted by COVID-19, among others. Douglas County initially plans to seek reimbursement in several categories, including those identified here. Staff has worked with state representatives to confirm that costs associated with the county's community health assessment and public health improvement plan processes, as well as the cost of running new telecommunications fiber to the new public health building, are eligible for reimbursement under this program. Staff will continue to work diligently to ensure that the county maximizes this funding opportunity in fiscal year 22 and going forward. This concludes my presentation. I can take any questions you may have of me.
Thank you. Are there any questions? Well, I do want to comment on vaccine refrigeration because that is a big deal. When I was at EPA and we were in the late 2020, I guess, and it looked like a vaccine was going to be developed. What we ran into that exact problem. It's not, you just don't stick this stuff in a refrigerator, any vaccine in a refrigerator, and hey, we're good. I mean, you need specialized refrigeration for that. And we were trying to get this stuff deployed out to the rest of the country. And one of the impediments we found was, where are we going to store it? Because you're sending it to the states, and the states are dispersing it out. And then you find out, where are we going to get it? Because you can't leave this stuff on, out in room temperature for any period of time. And shipping it was a real problem. And I think it's a wise capital investment to have that capacity. Again, not just for COVID vaccines, but for other vaccines as well, and for future vaccines that we may need. I think military facilities typically have, or some have that capacity. But unless you're close to a military facility, then you run into transport issues of how you're going to move it around. It's just a really, really wise investment. And I just wanted to comment on that because that bedeviled us back in late 2020 when we were working on it. So thank you. Any other comment? Okay. Do we have any comments in the room? Move to public comment. Do we have any comment in the room? Ms. Dunning, do we have any comment online?
I have no online comment.
Thank you. Oh, and we're going to move to citizen comment. And Doctor?
Hang on. Can I make a comment?
Oh, yes, please. Oh, I'm sorry. I thought you were pointing. I'm sorry. Yeah, Commissioner Teal.
No, sir, just gesturing for attention. So I find it very interesting with the slide that's up right now of potential reimbursements being the community health assessment and the public health improvement plan. So we did both in a community health assessment. Excuse me. Speaking of community health assessments, and a public health improvement plan to get to this point, really informing this board and forming our own department. So it kind of makes me wonder, Dan, now that you present to us that actually those are eligible for reimbursement as ARPA, or they're, I wonder, I do wonder if we want to take a position and perhaps direct staff to actually take that action to request that reimbursement.
Good point. Commissioner Thomas?
So it's my understanding with the ARPA dollars that the federal government has said that any community can automatically move 10 million over from the ARPA category to the general fund category, and that removes all those strings, and that then can be used to backfill all of these things we've already done. It seems like to me that staff has already told us that for 2020, the reimbursable that you all believe can come from ARPA is 6.1 million, and that you're working on the numbers for 2021, which would include these numbers. So it's possible that Douglas County could document that our ARPA reimbursement back to the general fund could be like 12 million or something like that. So we wouldn't be just stuck at the 10 million that the feds have said you can do without having to show all of the documents to support that. Is that correct, Dan?
When we are discussing the county's $68.2 million ARPA allocation, that's an accurate assessment. We have two choices, two divergent choices when we are seeking what Treasury calls revenue loss reimbursement. We can take that 10 million that you identified, or we can annually calculate our loss plus a growth factor in our budget. And our budget department is analyzing which option is likely to be the best financially for us. It will either be the 10 million or, depending on estimates of future revenue growth, an annual calculation that we do. The pot of money identified on these slides is separate. This is state ARPA dollars that we receive because we are operating a health department now. So the $519,000 eligible here can be spent primarily on focused efforts that tie back to a COVID-19 response in some way.
I'm sorry, I missed that part. I apologize.
No problem at all.
So I actually want to circle back to your question, Commissioner Teal. One, have you gotten an answer, I guess, or do we need to provide some direction? What do you recommend we do here?
Well, that's the deal, and thanks for actually that clarity again, Dan. I appreciated it, but it just strikes me that, yeah, we should be pursuing. I mean, I spoke earlier of the criticism that we have received in the press, and I very much recall a couple of articles that talked about how we made promises to save the people of Douglas County money, and here we were spending money on a community health assessment and a public health improvement plan to get us to this stage. So personally, I think that becomes something that, yeah, we really need to pursue those reimbursements so if they are qualified.
So why don't we do that? Why don't and I don't know that we need a motion, but why don't we request that staff go and examine whether we can get reimbursement for the community health assessment we've done and the work that we've done in this area in terms of health assessments or planning work that we've done up to this point that fall into the category of other public health services, including those listed and those that may not be listed but that may be eligible. I don't know that we need a motion to do that. I think we're just asking you to report back to us by the next meeting on your findings. Is that sufficient, Commissioner Teal? Great.
Absolutely.
Any other comment on that? Any other questions? Excellent. Then why don't we move to the next agenda item? I think we called for it, but I guess let me, are there any additional public comment based upon the conversation we just had? Ms. Dunning, is there anybody online?
I have no online comment.
Thank you. So the next agenda item is meeting scheduling beginning in April, and I understand it's only February, but we wanted to make sure that we are reminding the public and also the board members and Dr. Fielding, we wanted to make sure that what we were doing was consistent with the request that you made of us several meetings ago, that we will be having our meeting start at 5 o'clock beginning in April, and we wanted to make certain that that was still a time that worked for you.
It will work for me if on some days I can attend online, because I do, and then as we get the schedule, I will probably get a request from my job, which is a 6 p.m. to 2 a.m. online position, to give them projected dates. And so sometime around April, I would truly appreciate if we could come up with maybe for the rest of the year what our projected dates are, at least tentatively, because we schedule in 6 months blocks. Okay. So I will attend, but I will attend at some of these online.
I think online is not a problem. I think we
Okay.
we certainly can accommodate that. We have in the past, so we can do that.
I would much prefer, to be here, obviously.
And we would prefer to have you
we'll try to
here.
accommodate that.
Thank you. What we'll also do is, Mr. Pratt, how far scheduled, we have meetings set up, how far out are we scheduled
I
at this
believe
point?
we're scheduled for the second Thursday of every month to the end of the year.
Okay.
Is what was
And
decided
if
for
that is in
last week.
stone at 5 o'clock, then I will put that on my calendar and attempt as much as possible to make the accommodations with my job to be here.
It is in stone.
Okay, thank you.
Great. I'll ask for if there's public comment on that. I don't believe there's anybody in the room that has public comment. I don't. Ms. Dunning, is there anybody online that would like to comment about our schedule?
No comments online, sir.
Great, thank you. In which case, we'll then move to general citizen comment. And I would, again, ask if there's anybody in the room that has any item of general applicability they would like to raise. Ms. Dunning, do you have anybody online that has any comment?
Thank you, Mr. President. I have no other hands raised.
Wonderful. Do we want Dr. Smith to?
By all means, invite him if he cares.
Dr. Smith, you're here. You're a public health doctor, and you are a resident. Do you have anything you'd like to share with the board? Just identify yourself for the record, town you live in.
I'm Dr. Gregory Dean Smith. I am the Policy and Medical Director for the United States Mint here in Denver, Colorado, and I'm also running for House Seat District 45 at the present time. One thing a lot of people don't know about me, and it's probably important, is that I was one of the 2 founding deans for Rocky Vista University here in Douglas County. So I spent many years working on that project. I went on to build 2 other medical schools. And as I listened, I also did a U.S. Public Health Fellowship in Washington, D.C., where they took 30 physicians from nationally every year, and 30 physicians were allowed to do a public health fellowship in Washington. And I've done a health policy fellowship for 1 year in Washington, D.C. as well, for which I earned half of my MPH degree. So I have been in academics full-time for 35 years. I also have a doctorate in administration and divinity and biblical studies. I like to go to school. It's kind of everybody's got to have a hobby. I collect degrees. What can I say? As I was listening to you, I thought it was very important, especially the dialogue of the medical officer. When we build and when I built medical schools, I don't bring in young doctors to help me do that. I really need somebody with experience. First medical school I built with Dr. Ronnie Martin here, He was 60 and I was 52, and everybody called me the young kid at that point because to be 52 and building a medical school was considered young. Now that I'm 65, I'm kind of middle-aged in that area. But it's very important to have stability, because one thing you're going to have is and especially unfortunately this time with COVID, I never had to deal with COVID building medical schools. But you're going to have a lot of scrutiny, and you're going to have a lot of people look at you saying, what are you doing? Why are you doing it? I understand, especially with Douglas County, you're going to have a lot of national people come in and watch what's going on here right now, and that's okay. But you need somebody who has tough skin. Young doctors, as I've trained probably 2,000 or 3,000 medical students and 500 residents. I love them all, but they don't have tough skins at that point in their career, and it's very difficult for them. As I tell people, I also was a board of governor for the American College of Family Physicians. There were 8 of us that oversaw 35,000 family doctors nationally. I tell people we were not hurting cats, we were hurting rattlesnakes, because many times they might bite you if they didn't like what they saw. So you need people with experience. You need somebody, you have to have people that are going to be able to stand up and take criticism. If you don't take criticism in this job, you shouldn't be here, because that's half of what we do for those of us that are administrators or those of us that teach and build. I think you have a chance to develop a quality public health program here. I was here when Mike was talking. I was extremely impressed. I called Mr. Teal afterwards and said, you need to hire this man. His spirit, the way he presented himself was excellent. I actually asked him the question, and it wasn't a question I intended to be here even discussing, but I said, how are you going to deal with your medical examiner? Because I knew that was very important. And he gave me a response that was probably the best response I've had, and it told me a lot about him and his soul. He said, either the medical examiner will report to me, we'll report side by side, or I'll report to him. And that's important because it wasn't about ego. He wanted to do what was best. As I tell people, I'm a physician. I'm trained in surgical obstetrics. I delivered 2,000 babies. I know that all surgeons have an ego of some sort. But I also know that we also should be servants for what we do, either politically, academically, or as physicians in practice. And that's important. The other aspect I would tell you about is I also built 4 clinics here in Denver at one time. I started from scratch. I had 4 clinics. I had 3 physician partners. Everything they say about going in partnership with physicians and business is true. It's all bad, but we did well. During that time, I had my clinic system here in Denver, Acmed, Colorado, and that was when I was building a medical school here, and then I moved to Tennessee to build a school and started the foundations of Alabama College of Osteopathic Medicine as well. So I tend to like to be a little busy at times. So from what I've heard today, you guys are on the right step. Find somebody. George has been the entire board has slowly been twisting my arm. We shall see what happens. But I would love to help you in any way possible, and I'll be glad to take any questions you might have as well.
Thank you. Are there any questions? Well, thank you. Thank you for your experience. And thank you for your service to the community.
You're welcome.
With that, we are at the end of the meeting. I would seek a motion to adjourn.
So moved.
Second.
Second.
Thank you. We have a motion and a second. All in favor, say aye.
Aye.
Aye. Opposed? Thank you. We stand adjourned.
All right. Yeah. So you're looking for the light. As soon as it's on.
So it's the red light. It doesn't have a green light.
Correct.